Good morning, everybody. Welcome you all for this new edition of Sunday Special 60 Minutes with Psychiatry Teachers. I am Professor Kiran Kumar K from Bangalore. I've been the coordinator for Sunday Special program and a part of the Minds United team. We're very happy that this program is running for the past couple of years. And as an offshoot of this program, we have started the MUST ENRICH Research Grant, which is a Minds United Scholarship for Teachers, along with Indian Teachers of Psychiatry and Minds United, and it has been funded by the Infosys Foundation. We have today our MUST Research grant awardee, Dr. Sujoy Ray. We welcome you, sir, for this program. We also welcome his mentor and guide, Dr. Vinay HR, Associate Professor from Adichunchanagiri Institute of Medical Sciences and Research Center. We welcome you both. I hand over the session to Dr. Vinay without any further delay. And also, I would like to tell that all these programs are recorded, and we have our own YouTube channel. And the link for the channel will also be shared in the course of the meeting. Thank you very much. Over to you, Dr. Vinay.
Yeah, thank you. Thank you, Dr. Kiran. So continuing with the series of Sunday Special 60 Minutes, wherein currently we are going through the presentations of MUST ENRICH Research Grant Awardees. So today we have with us Dr. Sujoy Ray, who was working at IQ City Medical College, Durgapur, West Bengal, when he received this research grant. And he chose the topic of podcasts as a teaching learning method for undergraduates in psychiatry. So with even the difficulties that he had while because he was relocating to UK, so you could continue the project and made sure that it was completed, though there was a delay, but it was completed. And we have him in person, so he's going to present the topic and also the take-home messages from the project that he has done. Over to you, Dr. Sujoy. Currently, he is working in as a specialty doctor at Southampton, UK. Yeah, over to you, Dr. Sujoy.
Thank you, Dr. Vinay. Thank you. Good morning, everyone who is here. As Dr. Vinay and the others said, I will be presenting on the project which I did for the MUST ENRICH Research Grant. So I will just start without any further ado. Okay, so this is the title of my study, Podcast as a Teaching Learning Methods for Undergraduates in Psychiatry. So I got interested in this because I'm pretty interested in teaching, especially I like teaching the undergraduates, MBBS, nursing students, those people, because of it is more like they are taught more of the basics of psychiatry rather than very complicated methods. So I was thinking whether what is the way that those basics can be delivered to them in any other ways apart from the conventional lectures. And podcast was a method which I thought of because I did some of my own background search, literature search, and I thought that it has already been used in some places. So why not in psychiatry? So this was the premise of doing this study. And therefore I did this study regarding the podcasts. Now, coming to the background before the study was conceived, so whenever we are talking about a new method of teaching or learning, we have to go by the guidelines of the CBME, which competency-based medical education, which focus on certain things. Now, when what is expected of a doctor, what is expected of a person a physician in the training. So there are some points here which the CBME brings out. First is to be a good clinician. Obviously, this makes sense because being a clinician is the first and the foremost thing. Treating patients, being a good clinician, that is the first thing. Then a good communicator. So communicator meaning you have to communicate to patients, you have to communicate to your you have to communicate to the patient's relatives, your colleagues, and so on. And that communication should be efficient, short, crisp, and it should contain all the relevant details. Then being a lifelong learner, yes, of course. So again, this is all about teaching, isn't it? So nobody can say that they know everything about a particular subject, and they need to keep learning. Whatever stage of your career you are in, you need to keep learning. That is important. And then being a professional. So professional meaning the professionalism, maintaining boundaries, maintaining the proper ethics of the practice in that is one of the major goals, and also a leader. So being a team leader, not the leader in a paternalistic way, but more of a team leader to lead your fellow clinicians, nurses, and the entire team who's working. So that is keeping in mind these aspects. We should have all any method of teaching which is which is implemented should be covering these particular aspects. Now, in case of psychiatry, communication, professionalism, this becomes even more important, because most of the psychiatry work most of it is through speaking. It is through conversation. It is through discussion. This is much more there in psychiatry than in any other branch, and it's even the whether it is eliciting psychopathology, whether it is explaining treatment, it's all a conversation basically. So this some novel methods have I mean, a lot of studies have proposed, novel methods to attract students to psychiatry, which was not a branch earlier, which a lot of people would have taken up. Uh, then one of the things was OSCE. I mean, OSCE is not something unique to psychiatry. That has been happening earlier as well. You can see I've put the link for the RC Psych. So I've used the RC Psych as a sort of a reference here, although it's not the Indian standard, but even India, this is happening a lot now. And then OSCE has been replaced by online examinations. So OSCE used to be earlier, in OSCE is in general that the person would observe a student or a candidate doing certain things. In case of psychiatry, they will observe him doing a mental state, doing some examination, neurological examination, discussing with the patients. And now, to the extent the scenario has changed, especially more in the COVID pandemic and all, which I'll be talking about later, that this particular OSCE has been replaced by an online examination. For example, the Royal College it has now come back to face-to-face examination, but last I think 2 years or 3 years since the COVID pandemic started, the Royal College of Psychiatry in UK had switched its exams to online mode. So it is still an OSCE. People would attend it online for any part of the world, and then they would do it. So we can see that even examinations, they are changing their approach because of whether it is for accessibility, whether it is for COVID and so on. So similarly, I thought that even educational methods should have some new approaches rather than just didactic lectures. Hence the thought about the podcasts. Now, coming specifically to podcasts, I was saying earlier that they are being already used. I'm not aware of anything being used in India, but this thing is from the US. This is from the residency program in the US. Uh, this is being used there as you've seen, I put up increasingly by people in different stages of medical training. And this was a study which was done. They wanted to find out, this was just done in two departments, emergency medicine and internal medicine. Sorry for the this thing. Uh, and they found out, I mean, they tried to find out who are the people who mostly listen, what percentage of each uh, professional group listens to the podcast. So you can see 23% of residents, which in US resident means like PGs in India, 15% of the students, people who are post training, means who have become the specialists and all that. Then 2% of the pharmacists, 2% of the nurses, and this is something called as physician associate, a nurse practitioner. This is a new role in UK, US. It is not MBBS trained people, but even they are there in the healthcare. So these people are listening to podcasts already. So you can see most of it is the highest percentage is people who are post training. So people who finish their training, consultants and senior doctors, probably they need to keep updating their knowledge and new things, new aspects. They do listen to podcasts in this to update themselves. Now, what are the advantages? What I think, what these studies, which I showed one of the studies earlier, and there are other also. What are the advantages of a podcast, and what advantages do even I think that can be happen? So you can listen to these things, podcasts. Well, so podcast basically what it is, it's a short audio. Uh, it's a short audio clip. Basically, it's like a very condensed small talk in maybe 5 minutes or something like that, even less than that, about one particular focused topic. So what are advantages of these podcasts? You can listen to them while doing all your activities, whether it is cooking dinner, commuting to work, exercising, whatever it is. and they are flexible. So when you look at, I mean, if I have to straight compare it to didactic lectures, you cannot have lectures anytime. Lectures are always at a fixed time, date, whatever venue. But podcasts are an online record. I mean, podcasts are not online. They are recorded things, and you can always listen to them whenever you want. And when there are other things, whether it is lectures, whether even it is video, you're having a video conference and all, you should be expected to leave your things, come there and turn on your camera, turn on your mic and be there. But podcasts, if you want to learn through it, if you just want to hear a podcast, you can do whatever you like, and you can be listening to the podcast at the same time. So, and there is flexibility. It's something which is recorded. You can listen to it whenever you want, wherever you want. It's not a problem. And it is more efficient and enjoyable. The reason I say is that it's efficient, meaning small, I mean, a good amount of information is delivered in a small time. So usually 3 minutes, 4 minutes. So the crux of the important things will come to that, how I designed the podcast which I made. So they are delivered in a short amount of time, and the important information is taken. So it's also an enjoyable way. The person doesn't have to go through a tedious the whole thing about it. And then international expertise. So lectures by eminent personalities, etc., which may not be, not be able to, people may not be able to attend them in person. You may not have access to those lectures or those people in person, the experts. They can record their podcast and they can make it available for everybody. And this is a low stress atmosphere, less intimidating to learners. Not to say that other traditional methods are intimidating or anything, but listening to a podcast is just, as I said, it's a very enjoyable, simple way. The person is doing his or her work, and they can listen to whatever is they want to listen, whatever podcast or topic they want to listen. They don't have to uh, go to a lecture, concentrate, or I mean, as in give up their work or anything like that. So it's low stress because they know that they can do it any point of time. So again, apart from the study where I showed you, there is some already. This is also, again, these studies are in the US. They've already used these podcasts in some subjects of medical curriculum, that is ENT, and obstetric neurology, which is a super specialization in the US and Canada. So there has already been some use, and that is where they found out these particular advantages which I was talking about. So some questions arise, like, how can we best utilize these podcasts? They are there. How can we best utilize them? What should be the characteristics? How long should be a podcast be? How to make it more attractive? How it will compare to the traditional methods, especially in India, because as I said, India, we are not aware of any other studies with these things. And what should be the scope? We can't make podcasts on each and every topic, isn't it? We have to keep them short, focused, and, as I was saying, task and situation specific. And again, it would be a learning exercise. Let's say, I mean, here I'm talking about a podcast. Let's say we record a short podcast of a conversation between a doctor and a patient, and we say that we would want to give the student an overview of how it feels like to conversation when there is a conversation between a patient and a doctor, and how it should be. So we want to make a short podcast on that. So it will not be only a learning exercise for the listener, it will be a learning exercise also for the person who's making the person who's the role player in the podcast, and it will also be a even learning exercise for the teacher who's recording the podcast, because how to summarize your knowledge, so much of knowledge, how to summarize it in a way that you condense it in a 5-minute podcast for the student to listen to. So that is a learning exercise for both of them. So again, now coming to the objective of the study, I wanted to focus on undergraduates in topics of psychiatry to see how much their knowledge is improved. So they'll already know something about psychiatry, that is there, but how much knowledge improves following the administration of the podcast. What all improvement is there, what all betterment is there in the knowledge. So this is the thing. Now I must mention, as Dr. Vinay was mentioning earlier, the study was done in India. I was in the UK by the time I started the study, but I had friends and all there who the college I used to work earlier. They also helped me out with this. We chose undergraduate medical students. We actually chose those students who did not have psychiatry postings as of yet, and they may have heard of psychiatry topics just like that. So this would be your first and second year students, third semester students. Again, in the inclusion criteria, as I mentioned, they're currently pursuing their MBBS degree. As I said, qualified it further to those students who have not had psychiatry postings yet. Exclusion criteria, we took consent from the students, whether they were told that, this is a research study, you don't really have to do this if you don't want to, and it won't affect your degree and all. So if they did not want to participate, we respected that. And anybody who had any problems, I do not think there was any such student, but yes, anybody who had any hearing difficulty or anything like that, we excluded them. And those who had already had psychiatry postings and classes, because they already knew a bit about the psychiatry topic, so we wanted to keep it for very people who had no idea about it, because that earlier knowledge may have confounded something. Sampling, it was done, again, as I said, I was not aware of any studies which were done in India about this. We had a bit of difficulty in regarding the sample size, but whatever previous studies from the US can be picked up, and we usually use what is called as, convenience sampling, so that we just use the students who are there, who are accessible to the investigator, and decided on a sample of 100 students. I think they were taken from both the semesters, from the first and the third semester. So this was a cross-sectional study because it happened at one particular time. It was pre-post, so basically just a questionnaire. We mentioned online here, we wanted to do it online, but we later on they managed to bring the students and do it in a print form as well. It was initially a questionnaire was handed over to the students. They went through it. It's an MCQ type in simple questions about psychiatry. What do you think, which of these is a feature of alcohol dependence, which is not, so 4 options and things like that. That was administered to them. Then this the questionnaire was made. I have sent the questionnaire as well to the Minds United, and this was made by the investigators after discussion. And then that time itself, on the same day, around that same time, a podcast was administered, and then the questionnaire was re-administered. So initially, when the questionnaire was administered and the students answered the question and gave back, we did not tell them their scores, that, this is where you've gone wrong, this answer is correct, that answer is wrong, because you didn't want to bias them. So the questionnaire was given, the podcast was given, and then the questionnaire was re-administered. So we use what is called as the paired student test on the same person, that when the test is repeated on the same person. And overall 6 podcasts were given. I had recorded these 6 podcasts on, and the title of each podcast was made according to a SLO, specific learning objective, as per the CBME guidelines. These are the SLOs. Sorry for the long thing, but briefly, these are the SLOs. For example, describing the core features of depression. Should be able to enumerate what questions do you ask a patient with depression, what is the first line of depression, treatment of depression, enumeration of dependence criteria, eliciting how to elicit alcohol dependence with the idea of making a provisional diagnosis, and treatment covering acute and follow-up, very briefly. So 6 podcasts were made on each of these topics, and questionnaires were given according to that. Then yes, we whatever questionnaires we got, we evaluated them without having the students to write any sort of names or anything like that, and anything which was there, any identifying features were removed. It was coded, and we, as I mentioned earlier, we took the permission of the students, consent forms, and permission from the medical college and the ethical committee to conduct the study. Coming to the results, we use the mean and standard deviation before and after the administration of the podcast, and student paired t-test was used. The p value was kept at this, and you can see here the value has increased after the podcast. The mean has increased after the podcast. That is the main value, which is that is what we considered, and the variance has also come down. The scattering of the data has also come down. Now I understand, I'll be talking about this later in the limitations portion, that quantitative data may not be enough. It is more important to have a qualitative analysis and actually ask the students, did you find that the podcast was useful? Did you find that this new knowledge that you have, these questions you're answering, the score you got, the better score you've got, do you think it was because of the podcast? So this is something we did do it, but unfortunately somehow I kind of skipped my mind to include it properly in the study. So that is one important aspect in the methodology which could definitely have been improved. So this was the result we had. Now coming to the discussion point of it, so to the best of our knowledge, no other Indian study has evaluated such kind of an effect of podcast as such, but I think some studies have mentioned this. And coming to the challenges of using podcast, again, as I said, we did speak to some of the students about it, but this challenges which I have put is more from the American Canadian studies, that still, even though with the podcast coming in, people do find the live lectures more engaging. And in Indian settings, this will be a bigger challenge because lectures, PPTs, they've been the mainstay of teaching for a very, very long time. As long as I can remember, and definitely it's been a very long time. But the good thing is that ever since COVID-19 came, and this is the point I was mentioning earlier, online education has picked up, and that in that way the podcast could be more useful as compared to the other types of online education. For example, the way, as I was saying, Zoom and those kinds of things. Because for podcasts, if you just have a recorded podcast with you, you don't need to be very technologically savvy, whereas for the things like you don't really need to have an internet connection for a podcast. You can just have the recorded things sent to you. But whereas for online education, online classes, like which was done during COVID-19 for a lot of MBBS students, and familiarity with the technologies, maintaining focus, camera, this and that, lot of things, and proper infrastructure, these things have been a major problem. Even I have noticed that in the medical college I used to work. Whereas podcasts, these situations could arise, but it's much more easier because it's a pre-recorded thing, and then it doesn't need to be live. So even it can be made very accessible to students. So this is an advantage podcasts have, I feel, over the online education modes, which have become even more important in the post-COVID era. This is the same thing. I just wanted to sort of re-emphasize this point, that advantages of postcards as podcasts, as I said earlier, is it is easier to integrate it with the different jobs of daily life, whatever it is. Less likelihood. I mean, there are studies which found out that even with the computer education, the Zoom, the Zoom online classes and all, prolonged sitting, they have found in students that eye strain, headache, neck, back pain, these things happen. But in podcasts, you can keep yourself, students can keep themselves pretty much mobile. And this is what I was saying earlier. So this Canadian study, which I quoted, it also tried to go a step ahead and find out whether we're saying that podcasts are good, no doubt, but what should be the characteristics of the podcast that it should be really good. So they have found that the students felt 30 minutes or shorter would be better, and a concluding summary would also benefit their learning. I would personally say, I mean, these podcasts which I've recorded are hardly 5 minutes short. So even 30 minutes is quite a long time. Maybe probably they made 30 minutes over different periods of time, 5 minutes at one time. So this is just a precursor. I mean, maybe yes, more studies can be found out in Indian students, what they find, how how long the podcast should be. Coming to the limitations of my study, we have used podcasts as an individual intervention. We did not use a control group. So we did not take a student control group which was doing lectures and a student test group which was doing podcasts. So that would have been a better way to do the study, I understand. And this is one medical college, one sample of 100 students. There are different colleges, they have different infrastructure. So obviously the scope and the sampling needs to be more. Another thing which I felt, I mean, this is a English medium, English medium college, that is fine. But then there are many students who may want to prefer the podcast in their regional language, even though they may write the exams in English, a different thing. But you never know that they would like to understand it in a regional language, or some other mother tongue of their own. So that is something to be looked at. And as I said earlier, it's not just enough to do a quantitative analysis. You should actually ask the student that, okay, you've scored this much better in the post questionnaire than the pre questionnaire. Do you think the podcast contributed to it? How much did it contribute? Did you enjoy listening? All these problems, did you find your attention was weaning off? So these kinds of things should have been there. Yes, definitely. This is more like a pilot thing. And later on, studies we can include the qualitative aspects. I think, yes, these are these are the references, some of the studies which I was talking about. This is the ENT study, which already evaluated podcasts, and this is the one on obstetric neurology, which evaluated podcasts. I think they are in the US and Canada. And yeah, so that's where we are. Yeah. And these are some of the things about India, the Indian studies, which have proposed podcasts as a online education, as a mode of education. But as I said, I'm not aware of any studies which has actually done podcasts in India. Yeah, that's it. Thank you.
Yeah. Thank you, Dr. Sujoy, for that brief presentation. Maybe I'll just pass few remarks before I ask the participants to give their comments or share their experiences here. So I must admit that, yeah, it's a study with limitations of, first of all, it's a simplistic nature, design, sample size, and no comparison group. But still, there are a lot of positive aspects to it. If one were to look at the current trend of undergraduates, wherein currently now the trend is also about large in number, at least 150 minimum in every other medical college. So during lectures or even otherwise, they are found to be having earphones on with listening to some of the other lectures. I mean, though we might say that, okay, they are listening to something else extracurricular, but in fact, many of the students were actually listening to something academic, which they found out by exploring that they could hold on to some of the podcasts which were good and comprehensive enough, and they learn a lot better with those on, even to the extent that they question that we don't need to attend the lecture classes, we have this resources which are good enough, and they in fact have shown it in the results as well, in terms of exam results, right? So, and some of them interesting thing is that they've said that in the lecture class, with the visual distractions, like for example mannerisms of a teacher or many of the other sounds or this thing, so wherein they couldn't concentrate, so while hearing to a podcast, they could pay all the attention, and the take-home messages are learned better. And this is particularly with the background that we know that as part of medical education, so there are differential learners. Like we do say that auditory learners, visual, kinesthetic. So those who have a more of a auditory this thing, so they benefit a lot. And current medical education system should be kind of a catering to all kind of a learners, so that there are some aspects for each of them, each student who has differential domains of interest, so they should learn and they should have a resource for that. Okay, so in that regard, I found it interesting that yeah, podcast can be tried, given that there are no actual research projects or literature evidence it currently in India. The other thing is about uh, its relevance even beyond COVID-19 and pandemic. Though Dr. Sujoy mentioned that it started as in the background of COVID-19, but even otherwise, podcasts were always there, right? Only thing is that they got the much importance and the relevance they felt during this pandemic. Even the trend is currently continuing, though pandemic is kind of a sideline now, right? So other thing is, though it's a brief research, but it can give way for many other researches being taken up by those who are interested. Because I've come across some of the podcasts which are looked into the intricacies of the things, like what topics are to be chosen for podcasts, and how innovative can people become in terms of having just a lecture thing or a conversation between people, or within that adding kind of a background or music, or even for that matter, so that to make it palatable more, right? So in this regard, I appreciate the efforts of Dr. Sujoy, and maybe that the qualitative analysis or maybe the perception of the learner's perspective would have been much better. And if it's possible, maybe it can be extended, and maybe the cues can be taken from this. And I invite comments or any other sharing of experiences by others who are participants here.
This is Dr. Kiran. I think I've not used it personally, but it should be a wonderful experience because of late I have made an habit of listening to podcast of Mahabharata. I myself I am more of an visual learner. Because of the Bangalore traffic, probably I switched on to podcast. But the way I imagine Mahabharata in front of my eyes and the way it is effective, and as Sujoy was telling, the time duration each episode was about 20 minutes of podcast kind of a thing. It was quite effective. I myself was astonished that it could have been so effective. Okay. Anyway, so that I thought it can be translated into simple topics like what are the features of depression? How do you manage depression? What are the clinical features of any substance dependence? I think those should be wonderful. And I have a teenage daughter. I see them what they have. They like the way we were sharing notes in our days. These people share Spotify playlist kind of a thing. Okay, so I think it's the next generation Z or whatever you call it. We have to cater to the needs of these kids in future. So we have to probably use these resources. How much effective it is? Yes, we are probably a qualitative research and much more multi-centric research might be required, but there will be a set of population who will definitely benefit from these kind of resources. So wonderful attempt, Dr. Sujoy and Dr. Vinay. Thank you.
Thank you.
Any other questions or comments? Meanwhile, I'd like to share one more experience of mine in this regard, is that even though while creating a podcast, so there are a lot of things that are important, even the voice modulation part of it, how a learner would perceive it. Because I have one example that every other in Sunday special 60 minutes. So at the end, Dr. Mohan Issac sir gives comments. So much of the content that sir has said in each of the thing, as if like comprehensive and covering whole of what happened in the this thing. So I still can remember only maybe if not for the whole of the presentation. So I've remembered that part. So in that regard, yeah, maybe the importance can be given to the voice modulation as well, and the comprehensiveness, summarizing skills. So as Dr. Sujoy even mentioned at the end of it, so that makes it the podcast much more resourceful, I believe. Even maybe Mohan say Issac sir is here, so you would also agree upon that.
Yes, certainly. I would like to make a few comments. It's a very interesting study because we know about the podcast and its usefulness. And Kiran already mentioned how he has moved from, visual to audio because of the Bangalore traffic, how it is young people who are using it more. I think all over the world, the podcasts are more popular with younger people, need not necessarily be so. So it is an interesting study. I would like to make several points. I'll quickly make all of them. When the MUST ENRICH grant, MUST standing for Minds United Scholarship for Teachers ENRICH grant, I have mentioned this again and again, but I would like to still mention because those days when it was created, many people didn't know whether there'll be any good outcome. Initially, it was created because there were some funds available, and we couldn't cater to so many people for the scholarship scheme. I'm talking about not old history, but recent history, only 3 years or 4 years old. But listening to all these MUST ENRICH grant presentations, I have now been immensely convinced that with small funds, lot of ideas can be researched. Of course, it is not great finding, but it gives you some leads. It gives you some understanding of what the areas is being researched, etc. Its potential. It may lead to more important research. I've been listening to whenever I can all these Sunday presentations when the MUST ENRICH grant awardees have been presenting, and today's is no exception. It's a very good work, good piece of work, and lots of things are possible. The simple thing is that the traditional learning methods are learning and teaching methods are no more very valid all over the world because it's a younger population, technology, mobile, number of things. I don't have to go into the details. And we need to do more and more of these kinds of work. And so, thank you, Sujoy and Vinay, for this podcast presentation. But the point I was just reflecting as I was listening to the presentation. You're talking about podcasts. And now, what is podcast? Of course, Sujay initially in the first 2, 3 slides explained what a podcast is, etc. That it should be brief, it is educational, it's all over the world, extremely popular. One of the reasons why it's popular is the content is delivered in also an entertaining manner. Of course, I have not listened to the 6 podcasts of Sujay. Now that he has mentioned, I would want to listen to it and see how it is, etc., etc. But the point I wanted to make is we are living in very, very interesting times. The podcast, the word podcast is a combination of iPod and broadcast. The iPods became very popular in 2000, 1999 or 2000 or 2001. It was Steve Jobs, Apple computers. At that time, there was no iPhone. The mobile was there. In fact, the Apple computers were going down tremendously. And Steve Jobs, being a very creative and all that, he was thinking of getting apples into the market in some way because there were stiff competition. And that is how iPod was sort of invented. It was not any new thing, but it is creatively bringing something new, etc. And it became a big hit. In fact, 2000, 2002, 2003, initially it was expensive, but then it was the Apple computers iPod. It is much before iPad, iPhone, etc. The first in the series was iPod. So the way it was advertised was 1,000 songs in your pocket. It's a small gadget, you can have 1,000 songs. Of course, lots of things changed. The music industry, the way we listen to music, and now it came on to the mobile. Everybody listens to. In fact, the cover of this week's Time is from Karnataka in India, where a lot of very ordinary people are showing their mobile. If somebody is doing some work on artificial intelligence, I mean, you look at the cover photo of Time magazine, and you would feel immensely happy that it is from a remote village in Karnataka. That anything to come on the Time cover is very, very important. I mean, you become a kind of, the topic becomes a kind of important thing. So iPod and broadcast, and so that's how podcast came. It was in 2004. A BBC commentator made the first podcast. But what I wanted to tell you is we are talking about podcast as a research tool, I mean, as a learning tool for medical education, etc. But iPod is now buried. iPod has a rapid rise, and with lots of things which occur today, nobody talks. If you ask a young person, I mean, if I ask my grandson who is 12 or 13 years, who is not too bad in technology, he knows about mobile, this, that, what is iPod? He will probably, what is it? I mean, it's like the old type of phone which some of us have in our own houses, where you ring, dial, and then lift up, and there is a wire and all that. It's not so old, but it's already very antique. So, podcast is something which is very popular, but iPods have the rise and the fall has already occurred. This is one point. Now, podcast, for example, I mean, Kiran mentioned that he listens to. I am not in the Z generation. I'm in the. I I describe myself as a septuagenarian because few years, 2 3 years ago, I complete past my 70 years. Now, do septuagenarians listen to podcast? In fact, one of the things I listen to very because of you can listen. It's an audio. Not only in Bangalore traffic, even traffic anywhere when you are driving, there's no problem. You can listen, etc., etc. In the last 3 4 days, I've been listening to a lot of podcasts on Oppenheimer because a few days back I watched Oppenheimer, I had some information and some historical knowledge based on previous reading of history and Second World War and atom bomb and all that. But the movie, if you have not seen, it's not at all entertaining. It's about 3 hours. But anybody interested in history and all that, and also many of the points that Oppenheimer raised about nuclear in the context of, the war in Ukraine, it is very relevant. Those of you who have not watched it, I would advise you to watch it. Not at all entertaining. You have to go for it like going to attend a seminar or symposium or something like that, and you will learn. That's not what I wanted to say. But they've been having. I came across number of people who have been giving podcasts on, nuclear physics, quantum physics, in connection with Oppenheimer. And my own learning has increased. So there's no doubt that podcast is an extremely popular entertaining method of learning for anybody. But you have now, with a little piece of research, shown that there is tremendous potential and we should do much more work on this. Of course, now is it only audio? Can there be visual? Can there be podcasts which are also there? I mean, that is the technology of podcasts. But I think we are still talking about the primary mode of podcast. And as Vinay mentioned, these days, teachers like you and I are becoming more and more redundant. If you produce learning materials, the wise students will learn, and then thinking, all things like marking attendance and not letting people go for exam if you are not attended so many percentage of lecture classes, etc., all become very, very redundant kind of ideas. So thank you very much. I think you must publish it in whatever manner. It may not get published in the Lancet, doesn't matter. It may not even get published in the New England Journal of Medicine. But you must write it up, whatever you have done, with a little bit of introduction about podcast and all that, and how it is a learning material. You did mention about the Royal College of Psychiatrists initially. So not only for undergraduates and postgraduates, and you did mention that according to the NMC's goals for the new Indian medical graduate, one is lifelong learner. So podcasts are also very important for this lifelong learning process. I spoke so much because this is 1 hour. Sujoy presented in a very, very brief time. So back to you, Vinay. Thank you very much for asking me to speak.
Yeah, thank you, sir. Thank you very much for that, sir. So there was one query from Dr. Pournami, which Dr. Sujoy Ray has answered. So even sir has added to it that, yeah, there might be a period wherein lectures can, podcasts can take over, but still it's worth it. And also we'll have to live with it, the current learners' needs, right? And it's just that podcast can't be done for all the topics, right? As Dr. Sujoy was mentioning. So there are certain topics like factual remembrance or things wherein there are take-home messages like points. So those things can be done. Maybe for undergraduates. For postgraduates, it's much more kind of a narrative wherein, like, for example, psychopathology or psychology aspects. So some things, those topics can be picked up to make podcasts. So as sir said, maybe Dr. Sujoy has to make sure that the content sees the light of a publication. And please acknowledge the Minds United Trust for having given the scholarship whenever you send it for publication. Right? Right. Any other comments, queries? Because there is the this Karnataka annual conference, state level conference of Indian Psychiatric Society, which is going on at Bagalkot. So maybe the attendance is poor, but still the recording will be viewed by many of the medical education enthusiasts. So later also, so we can, if there are no, we can wind it up, I believe. Over to Dr. Kiran.
Yeah. Thank you very much, Dr. Vinay. Thank you, Dr. Sujoy, for that excellent presentation. We wish you best wishes for your future endeavors also. I would like to thank everybody for gathering here on this Sunday. And as promised, we will make sure that we'll not extend beyond 1 hour. We have finished before that today. Thank you for this wonderful opportunity from the Minds team. Have a wonderful Sunday to all of you, and we will wind up the program. Thank you very much.
Thank you.
Thank you, Mohan sir.
Thank you.
Thank you for all the participants.
Thank you.